This patient was referred to me 7 years ago. Wow, 2017 was 7 years ago. I can't believe it. 7 years ago for endodontic treatment of tooth number 3. She had cracked the tooth earlier eating chicken wings. And she had gone and seen her dentist, and her dentist, as you can see, tried to repair the crack and fill the tooth. Patient said, 7 years ago, patient came to see me. She said afterwards tooth started to hurt a lot. It was hurting to everything, hot, cold, biting, and all that stuff. So patient was referred to me for examination and endodontic treatment of tooth number 3. And well, on exam, number 3 was tender to percussion. Palpation was within normal limits. Probings were 2 to 4 millimeters all around. And as you can see, there is some calcification associated with the tooth also. So we discussed options with the patient because of the fact that tooth was cracked. A prognosis for the root canal was guarded. We discussed that with the patient. Also went over the alternative treatment, extracting the tooth. Patient said, no, I just want to try to see if we can save the tooth. Go ahead and do the root canal. You do the root canal, my dentist will crown it, and we'll see. I said, okay, very good. And that's what we did. Take a look. Again, this you can see 7 years ago when she first came to see me for this root canal. This was immediately after we did the root canal for her 7 years ago. And as you can see, here's the date, 2017, 7 years ago. This is another angulation and another angulation and another angulation. I accidentally, as you can see, fell short. Look at the distal buccal canal, you can see, and that was accidental. I accidentally fell short. And when I first posted this tooth, I'm sure a lot of you said, oh man, this guy fell short and this root canal will fail. But I was very confident that would not be the case because I know my science and I know Dr. Lin's, specifically Dr. Lin's study. I know that I had obturated, I know that I had instrumented and irrigated to working length, and I don't remember why I accidentally obturated short, but I was confident that this root canal would not fail. So again, as you can see, that was 7 years ago, but if I didn't have a 7-year post-op of this tooth, a lot of you would have said this root canal will fail because I filled the distal buccal canal short. As you can see, that's the radiographic terminus of the root there, and I'm short by maybe 5-6 millimeters. Okay, all right, so again, that was 7 years ago, and this x-ray is from when I had just completed the root canal, finished the root canal treatment. All right, so take a look now. Patient came in to see me for a different tooth, and we always take x-rays of the teeth that we worked on. Look here. That's the 7-year post-op of tooth number 3. Tooth has a crown on it. Tooth is in full function. No periapical lucencies. No periapical lucency here. That's my short fill, accidental short fill. Patient has no symptoms whatsoever. No issues with that tooth. And here's the date, as you can see. 7 years post-op of tooth number 3. Let me show you different angulation. That's a different angulation of the tooth. Again, you can see MB1, MB2, palatal, distal buccal that I accidentally fell short. So that's another angulation of the tooth again. No periapical lucencies whatsoever. Tooth is in full function. Remember, this was a cracked tooth also. So 7 years post-op of tooth number 3. A short obturation does not cause endodontic failure. Here you go. 7 years post-op of tooth number 3. Again, if I didn't have a 7-year post-op, a lot of you would have said, oh man, filling short can cause endodontic failure. No, I don't know how many times I can prove it to you. This patient was referred to me for endodontic treatment of tooth number 4. Same patient that I just talked to you guys about, discussed tooth number 3, came to see me in 2020. And the referral slip from the dentist said, number 4, root canal treatment of tooth number 4. The dentist diagnosed tooth number 4 as being the source. Well, as I always tell you guys, I don't trust anybody to diagnose for me. So I did of course, history taking, and did my own tests, and it was indeed tooth number 2. It wasn't tooth number 4. Patient had had a composite restoration of tooth number 2 2 months prior. Went to the same dentist, and of course, sometimes cognitive dissonance dictates that we don't see our own flaws. So the dentist who had done the composite restoration of tooth number 2 said, no, tooth number 4 was the problem. So if I had listened to this patient, to this dentist, I would have done a root canal on the wrong tooth. So I did my test, and tooth number 2 was the problem. And as you can see, here's the date. And this would have been the 3-year post-op of tooth number 3, by the way, because I had done this root canal for this patient 3 years prior in 2017, and she came to see me for examination of the upper right side, and her chief complaint was pain to cold. Anyways, all right, so that would have been 3 years post-op tooth number. Again, short fill doesn't mean anything. Doesn't cause endodontic failure. And this would have been, I just showed you a 7-year post-op, the 7-year post-op of the tooth, but this would have been the 3-year post-op of tooth number 3. Again, you can see tooth was in full function even then, 4 years ago. No issues or periapical lucencies or problems. So we diagnosed tooth number 2 as being the source of her pain to cold, and not tooth number 4. And we went ahead and did a root canal on this tooth. And here is the post-op of immediately after we did the root canal for her on tooth number 2. As you can see, MB1, MB2, distal buccal and palatal. And again, you can see maybe short a little bit, but again, I proved to you, not just by this case, but hundreds of cases that I've posted, and of course, multiple research, endodontic research, showing that the extent of obturation does not cause endodontic failure. And again, here's the date. So 2020, 4 years ago. So that was immediately after we had done the root canal on this patient on this tooth. All right, 4 years ago, immediately after. And here is the 4 years post-op of the tooth. Here's the 4 years post-op of tooth number 2. Tooth has a crown on it. Tooth is in full function. As you can see, no periapical lucencies whatsoever. No issues, no problems with this tooth. And this is again another angulation of the tooth. Another angulation here of the tooth. 4 years post-op of tooth number 2. And here's the date, as you can see. Right here. 4 years post-op of tooth number 2. Tooth is in full function, has a crown on it, no symptoms, no periapical lucencies, no issues. And again, 7 years post-op of tooth number 3. And again, you can see how short I was here. Didn't cause any issues, any problems. So 4 years post-op of tooth number 2, 7 years post-op of tooth number 3. And as you can see again, here's the date. So here you go.